Thank you, Chairwoman Miller-Meeks, Ranking Member Brownlee, and members of the Veterans Health Committee for hosting this important hearing today and for allowing me to wave on. Vietnam veterans have a much greater chance of contracting, suffering from, and dying from the liver fluke parasite, and yet the VA doesn't cover their health-related coverage. The correlation between the liver fluke parasite and service in Vietnam is obvious. In fact, a first-of-its-kind study was conducted back in 2018 at the Northport VA Medical Center using a 50-veteran sample size. The initial results of that study highlighted three basic things: the substantial need for greater study of the issue, the development of standardized treatment options, and broader accessibility of care for veterans at VA facilities across the country. So the VA conducted another study, and after years of delays, that study recently found there was a 30% greater risk of mortality from this bile duct cancer for Marines who served in the Vietnam War as compared to Marines who served elsewhere, 30%. However, the VA still says that the study is not enough. And it's clear to me, a Navy veteran, and countless Vietnam veterans who have been suffering from and dying from the liver fluke parasite, that there should unequivocally be a designation of service connection for these veterans. And that is why I'm here today, Madam Chairwoman, to speak in favor of my legislation, H.R. 4224, the Liver Fluke Cancer Study Act, which would require the VA, in conjunction with the CDC, to conduct a study to determine the prevalence of liver fluke amongst the Vietnam veteran population. Madam Chairwoman, our Vietnam veterans are dying every day, and we do not have the luxury of time. Too much time has passed already, and we went through a similar terrible situation with our Blue Water Navy veterans and Agent Orange. Let's not make the same mistake twice. I urge all of my colleagues to support this legislation, and I want to thank the Chairwoman and Ranking Member again for allowing me to testify in front of this committee, and I look forward to working with you and this entire committee to see this problem solved. Thank you, and I yield back.